Good evening to all our viewers. Namu Dr. Tebelelo, Pempunani. Thank you for watching Head to Toe with Dr. T. We always have very interesting topics for you, which are life-changing because we're doing life coaching. We're also doing health from your head to your toes. I've got very interesting, very friendly guests for you tonight who belong to the community of the Ts, the trans population, the minorities. They are here because we want to journey with them and hear their stories. Vuyo, can you kindly greet our viewers as well as you, Cavon? And thank you for joining us tonight.
Thank you so much, Dr. T. Good evening at home. My name is Vuyo. I am 31 years of age. I'm a trans man from Ebisho, Ebalasi, but currently staying in PA. Thank you so much.
Hi, good evening, everyone. I am Cavon Oliver Orange from Port Elizabeth, Galvandale. I'm 35 years old and I'm a transgender man.
Transgender man, dependent transgender man. Do you still have your menses or you are on medication that has cut almost everything?
All right. So,
transition.
all right. Thanks, Dr. T. I think it's been 6 months now on testosterone. Okay. I started taking testosterone last year in September, 9th of September. But I'm still on my period. So when I started, I had this mentality that, okay, I'm going to stop my period eventually within like a month or two, but it still carries. But I have to say that there is a bit of change. I mean, I used to have like very painful period pains, okay. And the flow, I used to have like an overflow as well, but that has changed with time. I mean, my flow is different. The pain is there, but it's not like before. And yeah, as much as I don't enjoy them, I'm wishing and praying that eventually with time they can actually go away. Yeah, but I still do have them, Dr. T.
Awesome. You should be very interesting. You grew up in Alice, which is pretty rural, and dad and mom, how did they take the fact that they gave birth to a girl and then suddenly you identified yourself slowly?
Right. Thanks, Dr. T. So I grew up with my mom, but in Diliwele.
Okay.
Yeah, I'm a twin. I have a twin brother. He's late. His name is Siavuya.
Sorry for that.
Yes, thank you so much, Doc. His name is Siavuya Welengofe. So it was pretty much cool because even growing up as toddlers, I would wear his clothes. We would wear similar clothes. You know how twins are at home. Twins, yeah. But he would never be dressed as a girl, but I would be dressed as a boy. Yeah, even going to crèche and even primary school as well. The most interesting part was when he went to the mountain as the twins. We had to do it. Yes, I was so excited. One could swear that I was the one who was gonna stay there. So I had to do all of the rituals, ceremonies, from imbeleko to ibhokwe yokunqamla to umojiso to now when he was coming back, nam ndandiphansi kweraki, nam ndaqatywa. Nam ndayindoda.
That's an interesting journey.
So my journey began also at the 9th September. We are twins. So for me, yeah. So for me, the month started. I lost my periods. It's just disappeared. It's still gone. No pains, nothing. So I'm lucky. So my journey started like now recently. I just recently came out like for being a transgender man.
Okay.
So because education wasn't really a big part in the rural areas in Galvandale, so for me it was very very.
What made you think that you want to be a man? Is it something? Is it a thought?
It was
something
it was
that
always
happened? What happened?
It was always there. Growing up, being a transgender man was always there for me.
Okay.
So for me, I started being a lesbian. I was a tomboy first, and then I started to be a lesbian. So for myself, I
Why
wasn't
isn't
I
like a
wasn't.
gateway? This thing of being a lesbian says
I guess
tomboy,
I guess it
lesbian, and
is.
then
I get it. I guess it is. So for me, I didn't grow up with both of my parents. Only my mother. She was a single mother, so
Okay.
she had 3 kids to take care of. So I was the baby. So the baby was actually like I was spoiled, yes, but also it was mainly my mother was focused on getting bread, getting food on the table. So she couldn't educate us and sit us down and talk to us about sex and
Yes.
life orientation and all that. So as I went to primary school, I used to like wear tomboy clothes, and I never used to wear skirt, but my mother made me wear skirt because she thought I'm a girl. And so for me, it was a very tough journey because I had to grow up fast as a person, you know.
So, Vuyo, Kevin has highlighted one important thing that it's difficult for our parents to talk sexual issues with us. It's more like a taboo. How did you navigate the subject of coming out that you are who you are?
All right. So
Noting that our parents are, it's not a very friendly subject matter.
thanks, Doc. So I think for me, the topic of becoming also, I grew up in front of them. They've seen me playing soccer with my twin. They've seen me, I don't want to say being a lesbian, but they've seen me, being a lesbian in front of them. But this was also a subject we didn't talk about, right? But up until university, so I went to school and then I started working. And I would hide. I remember the time where I was still in university. I would go and do my haircut, a fade. But when I get a call that you're coming home on Friday, I would quickly go to the salon and check a girlish hairstyle there and do a S-curl quickly, and then go home. But it was such a difficult life to navigate because in East London, I used to be in adversity. I used to be myself, and then at home, I couldn't be myself. But I have to say, with time, as I'm an adult and working, so that has changed a bit, And sometimes we don't talk much about the financial freedom that the freedom that finances bring.
Yeah.
Because at least now I got to have my own space outside, my own flat outside, where I could bring someone and still say, oh, hi mama, this is my friend Sianda, but I'll be able to have my own space where I can be myself. So the issue of coming out, I never really sat my parents down and said, listen, I'm queer or I am gay.
You didn't call a family meeting and make an announcement?
No, I've always just lived my life. But
Okay.
also there's a certain freedom that you have now. Because when I was still living inside the house, I would be chilling there with my girl and I'm thinking, I think they hear us. I think they're listening to our conversations. I think they're listening to hear anything that is, making moves. But with the freedom that, and also as a trans person, I felt that you have to work 10 times harder than the other people because you need to constantly prove yourself that, yes, I'm trans, but I can also work hard, to fight for the acceptance in other ways. So I think for me, the financial freedom that I managed to have at a later stage, actually, I managed to maneuver with my family around that. But I never set them down in terms of saying, oh, I'm trans, oh, I'm queer, and this is me.
Sure. Thank you so much. We're going to take a short break, and then when we open, Cavon, we're going to take us through the issue of sex. We're going to open with sex because the reason I'm interested in your communities is because in sexual medicine, one area that we emphasize on is you belong to a population, we call you key populations. That is, you're in minorities. Some of you get scared to go to clinics, you've got STIs. Some of you get scared to even do HIV tests. And there's this, I don't know whether it's an assumption that you guys move from one partner to another, having multiple sex partners and whatever, and running away from testing and so on. So we're going to talk about those things and for real. And how do you guys actually have sex? Stick with us, and then we'll be back in a few minutes. Welcome back. We're talking trans men through the voices of Vuyo and Cavon. And thank you once more for actually opening up to us. It's not only about you, but it's about a population of people. People who are cornered, people who belong to the key populations. We're dealing with a burden of HIV in South Africa. How keen are you in terms of encouraging other people and also doing HIV testing? And also, if you've got an STI, is it easy for you to go to clinics? Do people welcome you like they would welcome any other person and so on? Any challenges?
Well, for me in Galvandale, it's very free. Our clinic is very free. They do not ask questions. They will always help you and educate you about sex, and there was always a safe space to go in the clinic department. So for me, HIV is a very important subject, because I know people that have HIV, and for me, I would say 100%. 100% people must have go test themselves and be safe, and always use a condomizing.
Yes, Vuyo, do you know about PrEP?
I do know about PrEP and PEP, yes, Doc, but all of this information was introduced to me when I started testosterone. Or I knew about it when I started testosterone. And even testing, it was the first time testing for HIV when I started testosterone. And in that moment, I thought about all the other things that I was doing before this moment. And how reckless I was.
Thing. Everything begins to haunt you.
Yes. So in terms of protection and taking PrEP and PEP, and these are the things that came to me in that moment. I've been reckless in my entire life, and this is something that we don't talk about. The sex that we talk about is heterosexual sex, a man having sex with a woman, and we do not do sex education in terms of safety for queer people, dental dams, finger condoms, and these are not things that are even available in most of our clinics.
I wish you had brought them, just to demonstrate it, so that people see it. Because people think I'm joking when I say that dental dams, there are finger condoms, there's a condom. I mean, we are getting to overalls now. I think we're going to wear condoms.
Cover your whole body.
But one thing I know, sex won't stop. Cavon, are you guys dating?
At this moment, I am seeing someone,
Okay. And how is it going? Because one question, when I host people who belong to LGBTI communities, I always ask them, how do you guys do sex? Because there's this thing of people calling corrective rape, people who hunt people who are lesbians, people who are gay, people who are trans, and want to rape them, thinking that they're going to convert them and whatever. So that is something we're fighting against. And maybe one question that is always eluding or people running away from answering, how do you guys have?
Well, for me, being a lesbian before, I've become a transgender man.
Okay.
Sex was very fun, very excited, there was a lot of positions and things that you can do that I didn't even know. I experienced on knowing the lady's body, because I've been having sex with women.
Okay.
And it was interesting because like you get to the point that you actually educate yourself and the partner that you have sex with.
And people in sex, they can be very adventurous. Any use of sex toys, any materials?
Yes.
Yeah. No, of course, Doc, of course. Yes, of course. Yeah, that's actually our favorite subject to talk about. Yes, I personally own strap-ons. I've owned.
What are those now?
So a strap-on is like a dildo,
okay,
but that you wear.
All right, I see.
I call it Roxy. I have a name for it. I call it Roxy. And Doc, it doesn't feel like, I always say this, it feels like an extension of myself. It doesn't feel like, okay, this is a toy, you know, I don't call it a toy. This is an extension of myself. And when I have it, I do feel that this is an important part of myself,
Sure.
right? So yeah, I do use toys, and I love Roxy.
So my one's name is TikToker. So yeah, so I have also a strap on, but it's a two-way strap on. So it's for if you want also to be pleasure.
Okay.
At the same time, when your partner's pleasure, that's for.
Oh, it's a two-way?
Yes, it's a two-way.
Is it vibrating?
No, it's just the silicone.
Oh,
Yeah.
so you have to work hard.
It can bend. It can bend.
Oh, okay,
yeah.
sure.
You get a hard part. You get a hard ones. You get a soft ones. You get a silicone ones. You get the ones that vibrate.
Yeah.
Yeah.
So there's different kind of toys that you can get
I see.
out there that can pleasure you in a way that you want to be pleasure. So for me, TikToker is actually a very big part of
And then
my
in Pembe,
journey.
is it any consideration? Or you did away with that? You don't know how to say it?
I think for me, Doc, with the reality of our health services in South Africa, especially in the Eastern Cape, I mean, it's difficult for us to even get top surgery.
Okay.
The reality is that even if you do want impempe, even if it's 5 centimeter, the reality, you might die without getting it in.
Yes.
That is our daily reality as trans men. So we're not even thinking as far as getting impempe. We're just perhaps in terms of that, maybe getting a top surgery.
Okay.
You know, so as much as you're thinking about it, but you know, it might not be possible.
I see. And what kind of treatment are you getting now in terms of the top surgery? Are you getting any services in South Africa? I know VETS is doing a lot of research, VETS RHI.
Yes.
But in Port Elizabeth, it's a very, very low. We only have educate about testosterone and hormones treatments and stuff
Okay.
like that. So for us, it's a very important topic because we as transgender guys want top surgery.
You want
It's
to
very
do away
important.
with boobs.
Yeah,
Yeah.
it's very important to us.
Yeah, I understand there's a pressure on public outlets, and
Yes.
unless you guys had money to do it privately, I know the
Privately.
state is very much under pressure with dealing with bread and butter issues. They will say, no, gamachamba lawa and whatever. Because sexuality is still is
Yeah.
still not treated as
Prioritized.
a basic need. Yeah, we're dealing with TBs, we're dealing with the ARVs, we're dealing with whatever. And they may not consider it a priority until everyone is at the same level in terms of knowledge, which is the importance of having this session. We're going to take a short break and then we'll be back to wrap up the session. Thank you for being with us. We are with Cavon and Vuyo, the transgender men. Welcome back and thank you for staying on. And this is Mpumakaba TV, channel 260 at 7:30. We're talking health and we're talking life and we're talking sexuality. Now we're focusing on the T of the trans population through the eyes and the journey of Cavon and Vuyo. They are not partners actually. They've got their own partners. And then how are things going at home in terms of chores? Have people accepted now that you are in therapy? Did you tell your families and how are things going?
I mean,
Are they supporting the journey?
that's a difficult one, Doc, because it's very, as I say, this is a topic that we don't necessarily talk about. When I came out to my cousins, it was like, but that's too much. We've already accepted you as a lesbian. Now you're moving the bar higher. And how are you expecting us to, again, trying to make sense of this? And I would say it's been really difficult because I also go to church. I'm in a church, I'm in the choir. And before I can get to be myself, be my authentic self in the church, you know, the conversation then starts at home. And these are conversations that our parents they do not necessarily want to have, or they do not open that door. So you find yourself that, yes, you do speak with your siblings and they know about it. I mean, I took my testosterone injection in December when I went home, and there wasn't much conversation about, you know, being a man and all of these things. And also you must remember what that looks like back in the lallies, that you know, even when there's a ceremony, men that side, women this side. And even growing up, I find it difficult to belong in either spaces. So in my big age, I still stay with 13-year-olds, 14-year-olds, because there's no sense of belonging with either sides. So I mean, at home with siblings and cousins, I mean, they're okay with it, but there is that sense that this is a bit too much, you know.
Cavon, in hospitals, in toilets,
It's
which side do you go?
I always been unisex, so I always to go to male or female toilets, you know. But now for me, more male as being in a female toilet. So at work, it's a very difficult thing, but I actually struggle at
But
work.
people have to know what is happening.
Yes, I'm a very educated person and
Awesome.
open person,
Yeah.
open-minded person. So I did tell them, but for them it's a joke, you know. So they're not really serious about the situation, what it is all about. So for me, sometimes I do feel it, but sometimes I also don't. I also joke around with them.
Tell me, when you are sitting with men, in terms of feeling and actions, most you are more like a man,
Yeah.
because a trans man. When you are sitting with men, you still have equals.
Yeah.
Does it not bother you, or don't you feel a bit different, or don't you feel a bit awkward, or how are other people receiving or perceiving you?
I think to start off, when I talk, it's a matter of understanding that some men have vaginas and some women have penis.
Yes.
So the education start there, that not all men, even cis men, or men with penises, their penises are not the same, right? So it's just an education to understand that not all men have penises, some men have
Sure.
vaginas. And
You put it very well.
yes, and even that question, talk about bathrooms, you know, for me it's a sense of safety. So I still use the women bathroom, because in the men's bathroom there's a huge sense of safety that I don't feel.
Okay.
I don't feel safe going in there. And in the women's bathroom there's uncomfortability. So I choose being uncomfortable rather than being unsafe.
I see. Safety and comfort.
Yes.
That's very interesting. If you were to be in a hospital, we've had issues, and we don't want people to, these establishments, they are not ready for what is happening, to be honest with you. You find yourself in hospital, which ward would you go to, or where would you prefer to be, without offending anyone or making anyone uncomfortable? Because it's not only about your own comfort, but the people around you also. Make our lives easy.
I mean, I think we've been doing that a lot of our lives, Doc, trying to make other people comfortable, trying to make our families comfortable,
Yes.
workplace, classes, at school, everywhere. You know, I think for me, I would go to the men's section, because now I'm in a journey of really affirming my own gender. I can't
Sure.
also just tiptoe around what people are going to say and that. And I will also just say, yes, I am a trans man and I need to go to the men's side, right? And it is the
Awesome.
duty of that hospital to also make sure my safety there,
accommodate you.
yes, my safety there is not compromised, because now it also speaks to other things like gender, like your ID, because also when you're in hospital, they're somehow gonna need your IDs and all of those things. So when we talk about transitioning, we talk about socially transitioning, where you don't have to take testosterone.
And by the way, what is happening with your IDs?
I am gonna change my name. So at this moment, I am basically I got my letters from the doctor, the therapist. So I just need to go to Home Affairs and go to.
You change everything.
Yeah, go to change it. It's a gender marker. You can decide. You get the gender marker, and then you can change your name if you want to change your name.
I see.
Yeah.
Yeah, I think for me, Doc, I'm going to wait for certain features for me to be comfortable. Like, I'd really love to have a beard. so that if I take that for
It's gonna take time.
dinner.
I'm gonna show you.
Yeah, so I'm really willing to wait. So if I take my ID now and change it, I might not be happy with still this facial look. So I need to, when I go to the airport, still show the person that I want to see.
Okay.
Right. So I'm gonna still wait a bit for that person to come.
It means you are saving a lot. But at least there is hope in terms of beard, because your colleague
Yeah, but the acne is bad.
already has the big
Like
one.
I have already acne as coming, you see the
Yeah,
acne, so
in
it's
terms
bad.
of side effects, have you
Yeah.
experienced side effects of
Yes.
testosterone? You
Yes.
had everything tabled most before you started.
Definitely.
Yeah.
And bottom also. Bottom
Yes.
growth. Yeah. It's a sensitive.
Yeah, it is.
Yeah.
It is. But every journey has got those pitfalls.
Yes.
Exactly.
Yes.
Thank you very much for honoring our invite, and thank you very much for opening minds and educating other people. And thank you for sacrificing yourselves. For this is a journey, and you could have liberated a lot of other people who are watching the show. And thank you once more. And to everyone who's watching, this is Apile Communications at Head to Toe with Dr. T, Kumpuma Kappa TV. Thank you for being with us, and see you next time. Thank you.